Welcome to The Explainer. Today, we're tackling a topic that literally almost all of us have wrestled with at some point, especially during those teenage years. Yeah, we're talking about acne. It can be just incredibly frustrating, right? It messes with our skin, sure, but it also really takes a toll on our confidence. But hey, here's the good news. We aren't just gonna throw some surface level tips at you today. We're going on a biological detective journey. We're gonna decode exactly what's happening under the surface of your skin, understand the actual science of why breakouts happen, and map out exactly how you can take back control. Okay, let's dive into this. Have you ever noticed that a massive pimple always seems to pop up right before a school dance, a big game, or maybe a huge presentation? It's like your skin knows. Well, it's definitely not a coincidence. And let me be clear, it is certainly not a failure of your personal hygiene. A breakout is actually this fascinating, albeit super annoying, biological process. It's a microscopic chain reaction. And the coolest part, once we understand the steps of that reaction, we can totally outsmart it. Section 1. The biology of a breakout. Investigating the culprits. So, to stop a breakout, we first need to visit the scene of the crime, the pore. Or, if you want to use the fancy dermatologist term, the pilosebaceous unit. Now, our first culprit here is sebum. Sebum isn't inherently bad, actually. It's just a natural oil your body produces to keep your skin hydrated and protected. But during our teenage years, our bodies experience this massive surge in hormones called androgens. These androgens basically send your sebaceous glands into overdrive, telling them to produce way too much sebum. Suddenly, your pores are just flooded with oil. Now, mix that excess oil with dead skin cells that aren't shedding properly, a process called hyperkeratination, and bam, your pore suddenly turns into this sticky, microscopic trap.
And this brilliantly illustrates what's going on. Think of a healthy pore like a clear, flowing pipe. It's totally open, the sebum flows naturally to the surface, and oxygen easily gets inside. Perfect, right? But when that hyperkeratinization happens, the pore gets completely blocked by all that excess sebum and dead skin cells, creating an oxygen-free trap. And biologically speaking, this blocked, airless environment sets the absolute perfect stage for our next culprit to just thrive.
Inside that blocked, oxygen-free pore, a naturally occurring bacteria called Cubiterium acnes, or C.acnes for short, goes to work. Now, C.acnes lives on everyone's skin, but in this trapped, lipid-rich, oily environment, it has an absolute feast. As the bacteria rapidly multiply, they trigger your body's alarm system, your immune system. Your immune cells rush to the site to fight off the bacteria, releasing all these inflammatory signals. And you guessed it, this fierce microscopic battle is exactly what creates the red, swollen, inflamed bump you end up seeing in the mirror.
Section 2. Meet your skincare heroes. Science-backed active ingredients.
Now that we've identified our microscopic culprits, the excess oil, the trapped dead skin cells, and the feasting bacteria, let's introduce the heroes of our story. The big three science-backed ingredients. First up, benzoyl peroxide. This powerhouse literally pushes oxygen into the pore, directly killing that C.acnes bacteria and helping clear the blockage. Now, what's really interesting about this slide is that a 2.5% concentration is actually highly effective for facial acne, and it helps minimize common side effects like extreme dryness or redness or, bleaching your favorite towels. Next, retinoids like adolescents. These act kind of like a traffic cop for your skin cells, normalizing cell turnover so dead cells don't pile up and clog the pore in the first place. Just get aware they can cause some initial sun sensitivity and flaking. Finally, salicylic acid, a beta-hydroxy acid. Because it's oil-soluble, it can actually dive deep inside that oily pore to dissolve the trapped debris, though it can occasionally cause minor irritation. Knowing these side effects is absolutely crucial because how you use them matters just as much as what you use. Section 3. Your step-by-step daily routine. Your map to winning the battle. So, how do we actually put these heroes to work? When it comes to teenage skincare, consistency and gentleness matter way more than having some complex 10-step routine you see online. Here's your morning map. Step 1. Wash with a gentle, non-comedogenic cleanser, which just means it won't clog your pores. And no harsh scrubs, okay? Scrubbing just spreads the inflammation. Step 2. Apply a light treatment, maybe a low-strength salicylic acid or niacinamide to help regulate that oil. Step 3 is vital. Apply an oil-free moisturizer. Look, skipping moisturizer is a huge mistake. If you dry your skin out with harsh acne products, your dehydrated skin is going to panic and actually produce even more acne-causing oil to compensate. Crazy, right? Finally, step 4. Apply a broad-spectrum SPF 30+ sunscreen because a lot of these acne treatments make your skin highly sensitive to the sun. Let's move to the PM and see how this builds. At night, your skin goes into repair mode, so your evening routine looks a little different. Step 1, cleanse thoroughly to get all that sunscreen, sweat, and daily grime off. Step 2, apply your heavy-hitting treatment. This is where you use your retinoid or your benzoyl peroxide. But listen up, because dermatologists have a major warning here. Never apply benzoyl peroxide and retinoids at the exact same time. Benzoyl peroxide can actually oxidize and deactivate the retinoid, and combining them, it will cause extreme painful irritation. Alternate them on different nights, or use one in the morning and one at night. Finish up with a lightweight moisturizer to support your skin's healing process while you catch some sleep. Section 4. Lifestyle tweaks for clear skin. Habits that support skincare. What you put on your face is honestly only half the battle. Here's some rapid-fire lifestyle tweaks that drastically influence your skin's biological health. First, always wash gently twice a day. Ensure every cosmetic or sunscreen you buy explicitly says non-comedogenic. Watch out for physical friction too. Things like resting your phone against your cheek, tight collars, or sports helmets can literally press oil and dead skin right back into your pores. Gross, I know. Always shower immediately after getting sweaty. And don't ignore your internal biology. Psychological stress spikes hormones that ramp up oil production. And clinically, studies show that high glycemic diets, meaning diets high in sugary, processed foods, can trigger insulin spikes that also stimulate those oil-producing androgens. Basically, your diet and your stress levels are directly talking to your pores. Section 5. Preventing scars and flare-ups. Playing the long game. Setting up your routine is great, but hey, we also need to manage expectations here. Healing acne is not an overnight process, and getting frustrated too early is literally the #1 reason people quit and fail to see results. So the crucial point is this number right here. 4 to 8 weeks. Dermatological research shows that it takes at least 4 to 8 weeks of consistent use for active ingredients to actually show visible results. Plus, when you start something like a retinoid, you might experience what's called purging, where your skin temporarily looks a bit worse before it gets better, along with some dryness and peeling. Don't panic. This is a totally normal part of the cellular turnover healing process. You just gotta play the long game. During the clinical progression of a microcomedo turning into an inflamed nodule, squeezing or popping a pimple doesn't just push the infection out. Actually, scratch that. It often forces that bacteria and inflammatory debris deeper into the dermis, causing the hair follicle wall to violently rupture. And this deep rupture is exactly what destroys collagen and leaves behind permanent indented acne scars. No thanks. Long-term maintenance therapy and strictly keeping your hands off your face is the absolute best way to prevent scarring. Section 6. When to see a pro. Calling in the specialists. Even with the absolute best over-the-counter routines and habits, sometimes biology just needs a stronger intervention, and that is perfectly okay. You should book an appointment with a board-certified dermatologist if your acne is forming deep, painful cysts under the skin, or if it's already leaving scars. You should also definitely see a doctor if you've been perfectly consistent with your over-the-counter routine for 2 to 3 months with zero improvement. Most importantly, if your breakouts are causing you severe anxiety, depression, or just really impacting your ability to enjoy life, it's time to seek help. It is incredibly common to need a specialist. Dermatologists have access to highly effective prescription tools that over-the-counter products just can't match. We're talking prescription topical combinations, oral antibiotics to rapidly calm inflammation, hormonal therapies, and for severe cases, oral isotretinoin, which can essentially shut down acne production right at the source. The big takeaway here? You are not at the mercy of your breakouts. You now have the biological blueprint to fight back. Whether it's adding an oil-free moisturizer, stepping down to a gentler 2.5% benzoyl peroxide, or committing to that 8-week-long game, you have the power to take charge of your skin's biology. So I'll leave you with this. What small habit will you change today to protect your skin tomorrow? Thanks for joining me on The Explainer.